Hello, my name is Jane. I'm going to be talking about stroke in pidgin English. Now, wetin be stroke? Stroke na when the blood supply wey dey carry oxygen go the brain go come dey cut off. Now, wetin be that thing wey dey cut the supply wey dey go the brain, or if it happen? Now, when doctor don do im own treatment, treat the person, maybe una come see say the person don dey well, make una no leave the person like that, because then obviously the person go house, and when e don reach house, no leave the person like that. Obviously, maybe doctor go say make the person dey take aspirin, and if doctor no talk say make e take aspirin, remember tell doctor say, with this person wey don get stroke, make e dey take aspirin obviously once a day. And if you dey take that once a day, it go help am so that the second stroke no go strike. Because if the second stroke strike, na bilateral be that, and it dey dangerous for the person before the person go fit recover. Now, to manage stroke, na dey important. Now, if you manage the first one when you have, if you manage am well with treatment, the second one no go strike. Now, I go tell una, some nice tips, because if that person as well no fit dey swallow properly, you dey feed am, you dey give the person food, the person dey cough, e no fit chop, the person dey cough all the time, obviously the food go dey put am off, say e no wan chop again, e go dey lean, but e no go fit talk properly because the stroke don affect the swallowing side. You go assess am. Some people, there are no people wey be speech and language therapy, they call them SALT. Speech and language therapists na people wey be say they go assess your swallowing. They are professionals wey go assess, and then they go know whether you fit swallow. You fit do your own. They teach everybody. They teach people how to do am. You fit take small banana, mash am up, see whether the person fit swallow as normal. And again, you fit use your sense, say this person dey cough all the time, e no wan chop. Some people say the water when person dey drink, you fit put small, very small achi. I don't know whether una know wetin they call achi, but some people know. But na small thing when you go put for the water, it go thicken am small. Una know akamu when you go, or pap ogi when you go make, it go dey very light. The person wey get stroke, if it don't affect the speech, they fit drink am well. But if you give am something like hard meat or chicken to chew, swallow, it go dey very rough. You go come begin cough because the thing the food they go the wrong side for the throat. So now, obviously, person when stroke don't attack, it needs a lot of care. That person needs a lot of tender loving care, because if you look the person well, this na person where they waka, they go work, they do things for themselves before. Now the person no fit do am again. He needs somebody to stay there to maybe help him for toilet, help him to do other things. You know, go just leave the person, say, oh, doctor say make he take medication, make he take am. No, monitor the kind of medication where they take. And if not the one way really they bad, when I talk say the leakage for the brain and the person recover, some people they monitor them with medication where they call warfarin. Some of them are on warfarin for a long time, we be say for years ago, and it did very good. We say they help them to thin their blood, to they monitor their blood. But this one you need to go hospital once a week to take blood test, or nurse fit come take blood, go do blood test to see them. They get small machine when they fit take the blood. They call them INR test. They go test the blood there, and then they go know whether the blood don't dey too thick. If it too thick, they go reduce the amount of warfarin when the person will take. And if it's too thin as well, the blood don't too thin, they go increase the amount of warfarin when the person will take. Well, there's so many things concerning stroke, but the most important thing is to show the person love, care for the person, and you go see say the person go they live as normal. People they get stroke where we say one side of the body go they damage. 5 years, 10 years they see their life because they manage them well. And also manage your blood pressure, because blood pressure na they cause all this stroke. And if you get diabetes as well, blood pressure na they very, very dangerous. If it's too high, you no notice say your blood pressure dey too high, e dey cause this stroke as well. If you manage your blood pressure well, the stroke obviously you no go fit just strike like that. And again, some people dey do tests to manage cholesterol level as well, to check if it's too high or low as well. Well, that's all I have for you today. Thank you, Chika. Thank you, CTRIM, for putting this together. Take care and God bless.